In my last study, I looked at depression, fatigue, and declines in cognitive function with uncertainty in women with multiple sclerosis and how that impacts their quality of life outcomes. And in doing so, I found a symptom cluster with depression, declines in cognitive function, and fatigue. We knew that they existed. We knew that most of our patients with MS have all of these problems, but my research actually found it highly correlated at over 99% likelihood. I wanted to see whether or not there was a relationship between depression, declines in cognitive function, and non-primary fatigue. We talk about how individuals with MS have a 60% chance of having declines in cognitive function within 5 years of disease onset. We talk about how over 75% of our patients with MS report having fatigue on a regular basis. And we talk about how over 50% of our patients report some depressive symptoms. Not saying they have depression, but that they have depressive symptoms. So I wanted to look and see whether or not an actual relationship between the three existed. In MS, we had previously identified uncertainty as a problem, and in MS they talk about 3 different types of uncertainty. There's symptom uncertainty, there is medical diagnostic uncertainty, and there's outcome uncertainty. And so I wanted to pull uncertainty in there to see if that also impacted their quality of life outcomes, and it does. The higher the uncertainty, the lower the quality of life is for those with MS. I was very, very grateful. NARCOMs agreed to take me on, even though I was a student. They occasionally will do that, it seems, and they assisted me in the sense that I provided them with my data packs and my criteria. They identified the individuals who met my criteria. We mailed out my data packs, and then it was sent directly back to me. The nice thing is, so I never knew who any of my patients were. And even though I had sent out just data packs where they were scoring themselves on a Likert scale of 1 to 5, or they were filling out another form that was a 1 to 10, and it was supposed to just be quantitative information, so many of the patients actually wrote back extra information. They put notes in the data packs, or wrote letters, or included email addresses, other information, because this was something they wanted to talk about. And I included some of that information when I did my dissertation. I've included it today, and I've included it in some of the publication to show that this is something that's important to those with MS, and it's something that we really need to start being more active with and doing more with. It was a very small sample set. We thought I was going to need to actually send out to 500 to reach my data saturation. We did our first mailing to over 200, and I had an 80% response rate, so I was able to stop at 215 because I met what I needed to see. At that point in time, as we were going through the results, and I say we, and that's because I had little helpers who helped me make sure I did all my coding correctly. As we were going through all the coding and taking a look, found that we were at 99.4% at that point in time. To continue to obtain more and more subjects was only going to drive me higher than 99.4% at that point in time. So I found that if an individual reported having fatigue, decline in cognitive function, because it was perceived declines, or depressive symptoms, they were 99.4% likely to report all 3. So if they reported any of the one, they were most likely to report all 3. I also found that with greater fatigue and greater declines in cognitive function, in particular fatigue, or greater depressive symptoms, they were 99.1% likely to report higher uncertainty. So we really have a link between fatigue in particular and uncertainty, because it was 99.9% with fatigue. The higher the uncertainty that was reported by the patients, the greater likelihood that they had a lower quality of life in terms of physical and mental quality of life indicators. I was surprised to find out that uncertainty did not have a big impact on adaptive coping. Not positive or negative, it really had a null impact on it. And I don't really mean the term null, I meant a non-impact. And I was a little surprised by that. I had anticipated that uncertainty would impact both adaptive and maladaptive coping, and it would have impact self-efficacy and self-management, but it really didn't in the way that I had intended or the way I had thought it would. But actually seeing the symptom cluster on paper from research with such a high correlation to be 0.001, that was a surprise. As I mentioned, we all knew that it was there, we see it, but to have it shown from a research perspective, that was a difference, it was a change.